everyone. My name is Kenzie Rock, and you're listening to KR Live Podcast. This is the first season of 2020, which is all about mental health. Remember, mental health is mental wellness. So keep on tuning in to KR Live Podcast for these few months and listen on about mental health. So, today's episode will be all about dementia, and information presented from this episode today is from dementia.org healthcare brands. So, does someone you know have dementia? I don't know, but I'm pretty sure that this episode will be helpful for those who have met or live or are related to someone with any type of dementia. So, I'm pretty sure that most of you are wondering, what are you talking about? So, what is dementia? Dementia is an umbrella term. By umbrella term, I mean that it's a general term used to describe a decline in memory or brain function that impacts an individual's daily life. Dementia is very much different from the normal decrease in short-term memory that most people experience as they age, since dementia is an actual illness and is long-term. Dementia is caused by changes in the brain which impact cognitive function, and it can be associated with a number of types of dementia. So dementia has several types and several stages, which most of us are familiar with, like the Alzheimer's, the Parkinson's, the Huntington's, etc. So what are the symptoms, the many symptoms of dementia in general? There are variables associated with dementia symptoms, and there isn't a consistent pattern per se to the way individuals are impacted by dementia, but a person is impacted by their condition in different ways at each stage of the disease. So, depending on the person and at what stage they are, the symptoms will vary. In order to be diagnosed with a type of dementia, a certain patient with the symptoms should go through neurological evaluations and cognitive testing, and this will help doctors determine the rate of cognitive decline and possible therapy for this specific individual. But common types of symptoms associated with all forms of dementia include trouble completing everyday tasks like cooking or cleaning, inability to find things that have been misplaced, decreased ability to focus and pay attention, confusion or disorientation, especially about the day and time, personality and mood changes, struggling to communicate verbally and in writing, decreased judgment and reasoning, inability to adapt to changes, problems with visual perception, that is accurately judging distances, and also there is loss of motivation, apathy, and withdrawal. So the Diagnostics and Statistical Manual of Mental Disorders, this you've heard from every single type of mental disorders. You've had me talk about this edition. It establishes criteria for diagnosed dementia, such as the Alzheimer's disease, vascular, and some of the less common types associated with trauma, which is the Parkinson's disease, and other more general medical disorders. The complex nature of each type of dementia supports a wide range of testing to be completed before a diagnosis can be made. So, let me tell you about the types of dementias. There are many types, but the most common one will start off with the Alzheimer's disease, which I'm pretty sure most of you are common with, which is also known as the AD. This is a common type of dementia, with over 10% of Americans aged 65 and older suffering from the affliction. So I don't mean that not every other country has it, but from the statistics done in the USA, they found that 10% of people, both male and female, aged over 65 years old, have Alzheimer's. this percentage rises over to 33% in Americans that are aged 85 or older, indicating the increased risk of developing dementia associated with aging. So we'll find that Alzheimer's, is common to people 65 aged and older, but in rare cases you find that it appears to young people too. Alzheimer's disease is estimated to make up 60% to 80% of all dementia cases. This is why most people think that when it comes to dementia, it's only Alzheimer's, but it's not true. It's just that Alzheimer's makes up a greater section of this pie chart of dementia. It is a progressive disorder that destroys brain cells, leading to memory loss and impaired cognitive abilities such as thinking skills, judgment, and reasoning. Although scientists have not yet found a cure for the disorder, there are multiple treatments available today that have been shown to slow the worsening of symptoms and improve quality of life for both the patient and his or her loved ones. So, another type of dementia, apart from the Alzheimer's, is the vascular dementia, which develops from reduced blood flow to the brain, which deprives the brain of needed nutrients and oxygen, causing the decline in thinking and cognitive skills. Like most forms of dementia, there is currently no cure for vascular dementia also. Studies show that a heart-healthy lifestyle can have a positive impact on the progression of the symptoms of vascular dementia. Another form of dementia is LBD, which is the Lewy body dementia, which is caused by a build of proteins known as the Lewy bodies, Lewy, Lewy, Lewy bodies, in areas of the brain that affect both thinking and motor control. So you cannot think that clearly, and also you don't have control of your limbs when you have Lewy body dementia. LBD is a brain disorder that negatively impairs cognitive functions as well as movement. There is no known cure also for this to repair or halt the progression of Lewy body dementia. However, certain types of therapy and other treatments have been shown to successfully manage a patient's symptoms. So far we can see that three dementia types, no known cure, but there are therapies that reduce the symptoms. A new one is called the Parkinson disease. Parkinson's is a nervous system disorder caused by destroyed neurons in the brain. So the Parkinson's progressively impairs movement and speech functions. In other words, you're brain dead. Yeah, you're brain dead. The disease does not have a cure, but most symptoms associated with the disorder can be treated. An estimated of 50% to 80% of patients with this type of dementia will in time develop mild dementia, while approximately 20% of them will develop severe dementia. So it will depend with how the body responds to the Parkinson's disease. So like half of them will just get mild dementia, but 20% will get the severe dementia. Another form is the FTD, which is the frontotemporal dementia. The frontotemporal dementia is a group of uncommon disorder, so it's not that much common, and it's also a new term to me. But as an uncommon term of disorder that are characterized by their impact to the frontal and temporal lobes of the brain. Did you get that? It has an impact on the frontal and the temporal lobes of the brain. These disorders can have an impact on personality, the behavior of this person, motor functioning, and communication. Those diagnosed with FTD disorders are often younger than those with other forms of dementia, and they can be as young as 40 years old. This disorder is often misdiagnosed as a psychological disorder because of the drastic changes in behavior and personality associated with the degeneration of the frontal lobe. So when someone has FTD, you might think they're just crazy, but actually it's a form of dementia that they've got. Another form of dementia is the Huntington's. Huntington's, yeah, hunting and then a tons disease. This is a genetic disorder characterized by the progressive degeneration of nerve cells, which regulate mood, movement, and other cognitive skills. It is most commonly associated with involuntary movements, and those are often one of the first symptoms individuals with this disease will experience. The Huntingtons can also have a psychological impact, noted by changes in mood, depression, and increased anxiety. According to the statistics, about 30,000 people in the United States have Huntington's disease. To date, there is no known cure, but there is a management of symptoms, which has some focus when it comes to treatment. So they just focus on each symptoms. Let's say they have depression, they focus on depression and they try to round up this patient. If it's mood swings, they try to round up this patient. If it's increased anxiety, they also try to round up this anxiety so that they can control each each change instead of the whole thing, because it's just impossible to do that. So there are other many types of dementia, but the most common ones are those that I mentioned. So what are the causes of dementia? The causes of dementia is most commonly by the neurodegenerative disease, or the death and the damage of cells and neurons in the brain. So generally, you just find that if you have a patient with any dementia, that means they have either a neurodegenerative disease, or there is death or damage of the brain cells and neurons in their brain. So, dementia symptoms tend to vary because of the different areas of the brain that can be affected by the neurodegenerative disease. Dementia may also be caused by stroke. If you get a stroke, you can also develop dementia. Repeatedly traumatic head injury or brain tumors can also cause dementia. Only 5% of dementia cases are caused by other disease like the HIV infection, progressive supranuclear palsy, or alcohol-related brain damage. But the most common one is the brain cell damage, which generally will give you dementia. So these other diseases usually represent incidences of dementia in younger individuals. What are the treatments of dementia? You might be wondering why I said treatments, because as I mentioned, dementia doesn't actually have a particular treatment. But for most types of dementia, there is no way to slow or reverse cognitive impairment. There are medications and alternative treatments that are used to improve and alleviate symptoms. Treatments and medications will depend heavily on the specific dementia conditions in question. Current research suggests that exercise, dieting, smoking, cardiovascular disease, cholesterol, diabetes, and mild cognitive impairment may all factor into development of dementia. Making health lifestyle choices, especially during the middle age, may be integral. So, what are the many treatments of dementia? Unfortunately, most dementia-related conditions cannot be cured, as I mentioned earlier. For most types of dementia, there is no way to slow or reverse cognitive impairment. There are medications and alternative treatments that are used to improve and alleviate symptoms. Treatments and medication will depend heavily on specific dementia condition in question. So let's say they have Alzheimer's. The medication and treatment will be way different from this person with Parkinson's, or this other one with the FTBs. But current research suggests that exercise, diet, smoking, cardiovascular disease, cholesterol, diabetes, and mild cognitive impairment may all factor into the development of dementia. Making healthy lifestyle choices, especially during middle age, may be integral to dementia preventions. Preventive measures for any type of dementia may include reduce smoking and reduce alcohol abuse and recreational drug abuse. The second one is participating in mentally stimulating memory training activities like playing chess. That's a way to mentally stimulate your brain cells. Another is staying physically and socially active, eating a healthy diet, maintaining a regular exercise routine, getting adequate quality sleep. I've talked about the meaning of dementia, the symptoms, the causes, the types of dementia, but what are the treatments for dementia patients? Um, There is no general treatment for it, but there are preventive measures. As research for a dementia cure continues, taking preventive measures to decrease the risk of developing dementia becomes crucial. Certain risk factors like age or genetics cannot be changed or controlled, but there are many other factors that increase the probability of developing dementia. These factors may include drug or alcohol abuse, cardiovascular factors like high cholesterol, high blood pressure, diabetes, heart disease, stroke, hypertension, or obesity. Smoking may also give you dementia, mental health issues like depression, high estrogen levels in women, head trauma, high homocysteine levels. We also talked about head injuries, brain tumors. These all may give you dementia. But certain lifestyle changes can prevent measures that decrease the risk of developing any form of dementia. So, research suggests that it may be beneficial to stay physically active, stay socially active, participate in mentally stimulating activities, learn languages, or continue education, drink moderately. You may drink, but moderately. Completely quit smoking and minimize drug use. Eat a healthy diet, which research has found that a Mediterranean diet, which includes fish, nuts, whole grain, and plant-based foods, may be the most beneficial for dementia prevention. So if you were thinking about a healthy diet, go for a Mediterranean diet. If you're not a fan of fish, this is the time to start being the fan of fish. Adequately manage cardiovascular disease like diabetes, high cholesterol, or high blood pressure. If you already have the cardiovascular disease, you could try to manage it and keep it neutral, because if not, it can give you whatever form of dementia it can. These measures aren't only for individuals who want to prevent dementia, because these lifestyle changes are also beneficial for those who already have dementia, as positive changes can slow the progression of dementia. Meaning, if you have an aunt, an uncle, a son, a grandpa who has dementia, you can introduce them to this lifestyle change, and the change will prevent them from progressing into deeper stages of dementia. Medication for dementia depends on what form, because we have medication for the reversible dementias. Some reversible dementias actually do exist. For example, the vitamin B12 deficiency can cause the pernicious anemia, leading to dementia that can be treated by addressing the deficiency. So this is why there are reversible dementias. A dementia caused by something else. Let's say it's a dementia caused by a disease, like how the anemia is caused by the vitamin B12 deficiency, which can give you dementia. So you don't actually treat the dementia, you treat the deficiency, which in turn heals the dementia, if I may say so. That medication and supplements that can completely cure reversible dementias may include vitamin B12 supplements for those with pernicious anemia, hormonal supplements for hyperthyroidism and hyperthyroidism and other imbalances, SSRIs or other antidepressants for depression symptoms which may mimic dementia, antibiotics and medications to treat brain infections like the meningitis. So, to make this clear, reversible dementia is a dementia that's caused by either a disease or a deficiency, or it's something that mimics dementia. So since there isn't a particular way to cure dementia, you actually cure this deficiency that this person has, and it reverses their dementia symptoms, so they heal, as what most of you say, they heal from the dementia, which is not true. They actually heal from the deficiency they've got. Medication for managing dementia symptoms are many, very many, and when a dementia condition cannot be treated, slowed, or reversed, doctors and medical professions focus on medications that can make living with dementia easier and more manageable. So let's say this person has dementia, they're already in a very critical state, and they can't reverse the state they're in. So medical practitioners actually found a way to make this person cope with having to live with dementia, making their lives easier, making their lives more manageable for them and also their caregivers. There are several classes of medications proven to work at treating symptoms and reducing the effects of dementia. These they help cope with the dementia. They are mostly inhibitors and medications for managing mental health, mood, and behavioral issues, like the antidepressants, antipsychotics, and mood stabilizing medications, because they help with those suffering with depression or anxiety or mood changes, like the ones with the Huntingtons, yeah, and the Parkinson's. So side effects of this medication, like any other form of medication used to alleviate dementia symptoms, may include nausea, dizziness, vomiting, slowed heart rate, or diarrhea. So if you use any of these medications, the inhibitors or the antidepressants, and they get these side effects, just know it's normal that they feel nauseous, they get dizzy, they vomit, they get a slow heart rate, they get diarrhea. But a doctor or healthcare professional can prescribe the medication that best fits this individual in their condition and situation, so that they don't have these side effects. So don't just go rush into the drugstore and getting your uncle who's got dementia some antidepressants. First visit a doctor so that they can examine them and tell you what sort of medication they actually need at the moment. But there are also therapies which research has shown that improves well-being, day-to-day functioning, and overall mood in dementia sufferers. Dementia is correlated with increased anxiety and depression. So you might think that somebody with anxiety or depression has dementia. Yes, but not at all times, because they actually just correlated. So please don't make the diagnosis yourself. As I said, visit a doctor. So professional counseling and a strong support of system are integral to maintaining and improving overall well-being. So let's say this person with dementia has anxiety or depression. um, if they get psychiatric help, and counseling, they might get to learn how to control their anxiety or depression so that they can live much better, improved normal lives. Patients can choose from many different types of therapy, including therapies that align with their interests, like music or art therapy. Because these are most common, you see that they get healing through music, or some get healing through art. These are actually therapies that exist, and depending on their interest, don't force them into it. You just have to weigh their therapy depending on their interest. They don't have to go through normal counseling. They can actually go through interest therapies like the music, as I mentioned. The cognitive stimulation therapy is also another form of therapy, which is also known as the CST, and is clinically proven to help those with mild to moderate dementia, and is the premier therapy method for dementia patients. CST involves training memory, language ability, and problem solving skills in order to improve cognitive functioning, and can increase memory and reasoning skills without medication. So, this therapy, you don't generally use medicine or anything. It's just a way of improving and training mild to moderate dementia patients to get better memory. They develop language ability and also problem skills, the problem solving skills. They just train their brain to work work out. Yeah, you can say that they train their brain to work out. Behavioral therapy is also another form of therapy, which is usually administered by qualified family or loved ones of dementia sufferers. So you don't have to take this person to a doctor. If you're qualified, you can offer behavioral therapy to this patient who is, let's say, a family friend or actually a family member. This method is twice as effective as antipsychotics for treating symptoms like anxiety, aggression, depression, wandering, and also insomnia. Behavioral therapy involves tackling the triggers or causes of unwanted behaviors like aggression and wandering in order to alleviate and provide outlets for these behaviors without medication. For example, a trained caregiver may find that feelings of restlessness or stress cause the patients to wander away from home, and can implement an exercise regimen that helps them manage this restlessness. So let's say they find that let's say they are mad, this patient gets angry or gets too sad or gets depressed, they tend to wander away, they leave not knowing exactly where they're heading to. So to prevent this wandering around and leaving their homes, you find that as a caregiver, you give them activities that keeps them focused on something that will not trigger their restlessness. Another dementia therapy can be beneficial based on the situation, mostly, which we have validation therapy, reality orientation therapy, and these kinds of therapies are given several times throughout the day so that the patients can foster positive communication and reduce stress for the sufferer. Managing dementia. Managing dementia is actually a very tough job, especially for the caregiver. Dementia hugely affects everyday functioning, both for the patient and also for the loved one. And coping with dementia can require major lifestyle and environmental changes. You might have to move away from your home, or you might have to change the way you live or do things around your house because of this patient that suffers from any form of dementia. A comprehensive management system includes therapy and counseling to manage possible stress and anxiety and depression. A patient suffering from more advanced stages of dementia may need a caregiver who can provide regular or semi regular support. Some tools that the patients and caregivers can use to manage dementia include external memory aids, which is systems or devices, whether electronic or not, that help make up for decreased memory. They can include alarms that remind patients to take their medication, pictures, notes, message boards, or even clocks with information to help reduce confusion and disorientation. Another is consistent daily routine. Establishing a daily rhythm is helpful for the dementia patients, and a consistent schedule allows patients a higher level of stability and independence. Caregivers may also notice sometimes that the day when patients are more cooperative and less disoriented. Important events or activities should be scheduled for these periods. So another is stress management, which we can find that stressors and anxiety levels are different for each individual, as I mentioned way before. You find that depending on the patient, their stress levels or anxiety levels vary. So it's helpful to experiment with several different stress management methods. And examples are like exercises, calming music, meditation, interaction with pets and animals, social interaction, etc. Environmental modification is also a way of managing dementia. Factors like loud noises, bad lighting, glare-prone reflective surfaces, or clashing colors and patterns can cause agitation, anxiety, and disorientation in dementia patients. So, as a caregiver, you need to create a peaceful, calming environment to help reduce stress in these patients. And that, ladies and gentlemen, brings us to the end of today's episode, which is about dementia. I hope this episode of today was helpful to most of you, because I took it as a point of focus today, since I remembered that I have been associated with people with dementia, and it's really sad actually knowing that not most people know how to go forward after finding a patient or a loved one or a child or even a parent who develops any form of dementia. They actually get so confused that they end up leaving these people unhelped or even poorly taken care of. And it's really sad that people are misinformed about dementia. You don't have to take this child with any form of dementia to a mental institution. You don't have to take this old person with Alzheimer's to a retirement home. They need your love and support as a loved one and as family and as friends. We need to come together and help the community bring out better awareness to all forms of dementia, because in each and every country in this big planet, we have at least 50% of people who suffer from different forms of dementia, and it's really painful to know that they don't have someone to actually take care of them. So from today's information, kindly please take time and note behavioral changes within your family members. They might not know it yet, but they might be suffering from dementia, and it's a possible health risk. So they need to take medical checkups so that they can know how to manage their problems. And also, you as an individual, you might not have dementia, but you need to take more note about other people. You could train yourself to be a caregiver. You can actually get training to be a caregiver, or actually just volunteer to go to a children's home with people who suffer from dementia, because there are, and give your help and support in whatever way you can. So my name is Kenzie Rock, as you know, and this is the end of today's episode. See you next time.